Okay, so we have here a dogfish, and we're actually going to look at the cardiovascular system of the dogfish. And when doing so, the first thing to do is to take scissors and cut forward from the abdominal cavity. And what you'll do then is that you'll reveal the thoracic cavity. And in this individual, it's a little less clear than in some. But here we have the heart. And what's useful to note here is that we have, at the back of the heart, a sinus venosus, which is a little less clear, but it's going to be a bag which is going to connect and receive venous blood. Okay, you're then going to have the atria on either side of the ventricle, just here and here. Then you'll have the ventricle and the conus arteriosus. And the function of this heart is that it exists in a pericardial sac, which is inflexible. And so the consequence is that when this ventricle contracts and forces blood out of the conus arterius into the ventral aorta, this is actually going to make the ventricle smaller. And as a result, the atria, which are very, very flexible sacs, actually expand into the low pressure space in the pericardial sac. And that sucks blood in from the sinus venosus into the atria. Okay, now our ventricle will relax, and as a consequence, blood is then going to be sucked from the atrias into the ventricle, and additional blood is further sucked from the sinus venosus into the atria. So it's that simple system of basically ventricle is going to contract and atria expands, ventricle elastic recoil sucks blood in, and then it can expand again in the atria because the ventricle is contracted. So that's the function of this heart. All right then, so now what we can actually do is if our dogfish is like so, we can then in fact take a bone cutting scissors, insert them into the corner of the mouth and cut down the side of the head all the way to our cut just anterior of the pelvic, and then we can cut further across the dogfish's body here, cutting across to fully separate our heart and the lower jaw. And so that is what happens like so. We expose the arteries of the arterial system, and I'm going to guide you through these now. So if you imagine that the blood has come from this ventral aorta, it's gone through these afferent arteries into the gills, and then from those into the efferent arteries. And we've removed some skin from this dogfish here, and those efferent arteries are therefore going to send blood down into the dorsal aorta. Some goes forward in the paired dorsal aorta here, and further, more blood is going to branch off and go into these carotid arteries here, these inferior carotid arteries into the head. But we're going to follow the majority of the blood down the body into this abdominal cavity, into the major body organs of the abdominal region. So let's first just spot that dorsal aorta. It's visible here, up by the spine, just traveling down the body there. So the first branch coming off the dorsal aorta will go to feed blood into the intestinal systems and into digestive systems, and it's this one. It's the coelomic artery that's going to the digestive system. So you can see it coming off and up into this region here. Here it is in those mesenteries. The second branch coming off is normally the anterior mesenteric artery. So let's just see. There it is. And you can see that it's going to come across and then up here and then wiggle around and attach to the mesenteries of our intestine. Okay, so that one's called the anterior mesenteric artery. We then have another branch coming off, going across up here to the spleen and to the stomach, and that is the gastrosplenic artery. And the last one, which we can find when we go right down here, is going to be going here. Oops, sorry, pardon me. The last branch is going to go from the dorsal aorta to the renal gland. And this one's called the posterior mesenteric artery. And recall that the renal gland is controlling salt concentrations in the blood, and so that's a functional little connection. Now, blood, of course, has to return to the heart, and so the first return route is going to be via caudal vein, which will actually connect into some renal portal veins, because they're going from the capillary beds of the caudal region into the capillary beds of the kidney, which can be visibly seen just here. So that blood comes along the renal portal vein, through the kidneys, and then it's going to unify into the common inferior cardinal vein, I should say, the inferior cardinal veins. There's two, one on either side. All right, and that's going to bring the blood back towards the sinuses around the heart. We have further blood return via the lateral abdominal veins, also from the jugular in the head region, which I'm not going to show you. And all of this blood is going to pool in the sinuses that are anterior. Here they are. All these sinuses, you can see that the blue latex is pooled here. And that's ready to go into the sinus venosus. What about the blood coming from the digestive system? Well, first from the intestine, it travels to the liver. So that's capillary bed to capillary bed. So of course, that is a portal vein, and it is this one, the hepatic portal vein, which goes from your digestive system and over to your liver. And from there, it travels from the liver into these sinuses before we reach the sinus venosum that goes to the heart. Okay, and that's the arterial and venous system of a dogfish. Thank you very much.